Hello my dear friends. In today's video, I would like to introduce TCM Acupuncture to those who never had acupuncture before. The World Health Organization, WHO, reports increased use of acupuncture in clinical settings in the recent years. More and more people are seeking acupuncture and Moxibustion as part of their healthcare regimen. For many people, it may be their first time to receive acupuncture treatment. They have many questions about acupuncture. For example, before getting acupuncture, what things do I need to pay attention to? What are the normal reactions of acupuncture? Is there any problem if the needle punctures bleed? How long after acupuncture can I take a bath? What is the best resting time between two acupuncture sessions? I have found a great resource from China's premier acupuncturist, PhD and famous physician, Dr. Chen Kai. He has answered many of these questions in his YouTube video. I have made careful notes and will translate and summarize in the following video. For the first-time patients, there could be many questions and they might be quite nervous, a little worried and even scared before seeking acupuncture treatments. If patients cannot feel at ease and comfortable going into a treatment, especially for the first-time treatment, it could potentially reduce positive effect of a therapeutic outcome. Therefore, I want to spend some time to educate and introduce traditional Chinese medicine, TCM acupuncture, and Moxibustion. First, TCM acupuncture and Moxibustion are medical treatment disciplines of stimulating our meridian and acupuncture points. Both the acupuncture and Moxibustion rely on 2,000 years old meridian theory and adopt the idea of meridian dialectics. However, acupuncture and Moxibustion differs in the way that they stimulate the body. Here I want to explain the mechanism of acupuncture with my own understanding. Typically, when our skin is cut, scraped, or punctured, you will experience 4 stages of repel mechanism, according to an article published by Johns Hopkins University. The first stage is to stop the bleeding. It's also called hemostasis. So if there's any bleeding, the cells start to clump together to form a clot. It protects the wounds and prevents future blood loss. So these clots are formed by platelets, and then the protein called fibrin holds the clot within place. A very important mechanism is that serotonin will arrive to the site of puncture to stop bleeding and ease some of the pain you may feel. And the second stage is called the inflammation stage. That you may experience some inflammation as the blood vessel opens up a little bit and to allow fresh nutrients and oxygen into the wound for healing. So this blood-borne oxygen is essential for healing, and this is exactly what TCM calls qi and blood. It is a basic oxygenated rich blood along with white blood cells such as macrophages to protect wounds, fight infections, and produce chemical messengers called growth factors to enhance wound healing. In stage 3, the growing and rebuilding stage means many blood cells, including oxygen-rich red blood cells, will arrive to rebuild the new tissue. And lastly, in the strengthening stage 4, over time, the new tissue gets stronger, and you might notice, stretching, itching of the wound as this happens. And within 3 months, the wound is almost as good as new. And in my own understanding, this is how I see it. So the acupuncture is actually trying to simulate body's healing mechanism described above without causing wounds in our body. So the ancient Chinese physicians actually found a way to fool the body by puncturing body with hair-thin needles. This activates the body's repair mechanism, bring oxygen-rich blood, white blood cell, red blood cell, nutrition to the site of the puncture for healing. It also activates the body's natural chemicals called serotonin to ease the pain. This blood-borne oxygen with all its soldiers travel on 12 highways called the meridians. Each highway has many stations, or you can think of red-green lights called acupoints. So by stimulating certain acupoints, to me it is like ringing a bell and say, "Come here, soldiers. Nutrition, blood, and pain-calming nurses. I need some help to clear the traffic jam along the Meridian Highway, ease my pain, and prepare for healing." So when a doctor speaks of TCM needs, of qi and blood, now that you will know in your mind, he or she is talking about oxygen-rich blood with all the repairing and pain-killing soldiers who are traveling on this meridian highway to arrive to the station where the acupuncture needle is calling them forward. In acupuncture, needles are made of FDA-approved, individual packaged, pre-sterilized medical-grade stainless steel. They are extremely thin, even thinner than width of a thick human hair. The needles are sterilized with ethylene oxide gas, individually packaged and disposed after single use. You may feel a little tingling sensation as if bitten by a tiny mosquito as needles are inserted. This process is typically near painless. You may then feel different sensations include slight soreness, numbness, warmth, or pressure. These energetic sensation differs from pain, and patients often comment that although the feeling is unfamiliar, but it is not uncomfortable at all. Compared to acupuncture, Moxibustion is relatively weaker in stimulation as it does not penetrate the skin surface. It is a method of thermal stimulation on the body surface. It is more convenient for at-home self-care when needed. But for TCM doctors, after performing careful diagnosis, if the situation calls for it, they often combine the two to achieve maximum benefit for their patients. Other than the typical acupuncture needles you see in most clinics, there are many other special needles, such as skin needles, plum blossom needles, ear acupuncture, bleeding needles, etc., all of which are used for special treatments when it is called for. Skin surface therapy without entering the dermal layer are methods such as scraping, cupping, acumassage, etc. Other methods used include electrostimulation, use electrical impulses on ear acupuncture points, transcutaneous electrical stimulation, it's like the 10th unit. All of these methods attribute to the large family of acupuncture and Moxibustion. In part 2 of this video, I'm going to concentrate on the acupuncture-based or filigree stimulation. It is the most common used tool when you seek acupuncture treatments. And Dr. Chen discussed in his video several important items that the first-time patients need to be aware of.